When cigarette smoke is inhaled, it first enters through the mouth and nose, mixing with the air meant to supply oxygen. As the smoke passes the lips, teeth, and tongue, thousands of microscopic particles travel inward. These particles move through the throat and into the trachea, where clean airflow normally moves freely. Smoke disrupts this process, slowing the movement of air and replacing oxygen with chemical compounds. The airways begin absorbing these substances immediately. With every breath, smoke spreads deeper, coating the inner surfaces of the respiratory tract. What looks light and temporary from the outside begins interacting with living tissue inside the body. This moment marks the starting point of a chain reaction that affects breathing, circulation, and overall health long before any visible symptoms appear. Inside the lungs, air travels through smaller and smaller passages until it reaches the alveoli, tiny air sacs responsible for oxygen exchange. When smoke reaches these delicate structures, it does not simply pass through. Smoke particles settle inside the alveoli, reducing the space available for oxygen. The walls of these air sacs gradually become thicker and less flexible, making it harder for them to expand fully. Oxygen moves more slowly into the bloodstream, while waste gases are removed less efficiently. Over time, repeated exposure causes some alveoli to lose their ability to function properly. Breathing may still feel normal at first, but internally, the lungs are working harder to achieve the same result. This silent damage builds gradually with each exposure. Once smoke particles pass through the lungs, many enter the bloodstream. Here, they mix with blood that should be carrying oxygen to every part of the body. Blood vessels respond by narrowing slightly, increasing resistance and slowing circulation. The heart must now work harder to push blood through these tightened pathways. With less oxygen available, tissues and organs receive reduced support. Over time, this added strain places continuous pressure on the heart and circulatory system. Blood becomes less efficient at delivering what the body needs and removing waste. Although the heart continues to beat steadily, it does so under increasing workload. This internal stress often develops quietly, long before outward signs of fatigue or illness are noticed. The brain depends on a constant supply of oxygen-rich blood to function properly. When smoking reduces oxygen levels, blood reaching the brain carries less support for neural activity. Blood vessels supplying the brain may narrow, slowing flow even further. Neural signals continue to travel, but their response becomes less efficient. Concentration, reaction time, and mental clarity can be subtly affected. These changes may not feel dramatic, yet they reflect a biological shift occurring inside the nervous system. The brain adapts temporarily, but long-term exposure increases stress on neural network. What begins as reduced oxygen delivery gradually influences how effectively the brain communicates within itself and with the rest of the body. The brain depends on a constant supply of oxygen-rich blood to function properly. When smoking reduces oxygen levels, blood reaching the brain carries less support for neural activity. Blood vessels supplying the brain may narrow, slowing flow even further. Neural signals continue to travel, but their response becomes less efficient. Concentration, reaction time, and mental clarity can be subtly affected. These changes may not feel dramatic, yet they reflect a biological shift occurring inside the nervous system. The brain adapts temporarily, but long-term exposure increases stress on neural network. What begins as reduced oxygen delivery gradually influences how effectively the brain communicates within itself and with the rest of the body. Over time, the effects of smoking extend beyond individual organs and influence the entire body. The lungs expand less efficiently, limiting oxygen intake. The heart continues to pump against increased resistance, while blood vessels remain narrowed. Muscles and organs receive reduced oxygen and nutrients, affecting energy levels and endurance. Recovery after physical effort becomes slower. Internal systems remain active but operate under continuous strain. These changes develop gradually, often unnoticed at first, yet they affect overall physical performance. The body compensates for reduced efficiency by working harder, which accelerates wear on multiple systems. This long-term imbalance alters how the body functions as a whole, not just in one location. As internal strain increases, its effects begin to influence everyday life. Reduced oxygen delivery and lower energy levels can make routine activities feel more demanding. Physical movement may slow, and endurance during daily tasks decreases. Social interactions can also be affected as fatigue limits engagement and presence. These outward changes reflect internal processes working under pressure. The body is still functioning, but with less reserve and resilience. What others may notice as low energy or reduced stamina is closely linked to ongoing biological stress inside the lungs, heart, and circulation. The connection between internal health and daily experience becomes clearer as the body continues adapting to long-term exposure.